everyone. This is amazing. Our room is filled. I am Ann Mosenthal. I am the Regional Executive Dean of UMass Chan-Lahey and the beautiful space that we find ourselves in. And I have the distinct privilege to be your MC today. Thank you all for coming. It's really my pleasure to welcome all of you here in this really inaugural event of the opening of Walden House, which is our learning community of UMass Chan. Thank you to our distinguished speakers for coming from far and wide across Massachusetts to speak with us today, and we will hear from all of you in a few minutes. And thank you to our Burlington officials and town manager, select board members who are in attendance, and our community leaders. I would also like to give a special thanks to my partner, Ann Larkin, who is the Vice Provost of Education, who has really partnered with me to make this a reality. There's lots of thanks all around to our UMass Chan leadership, our BILH leadership, to really make this possible. So, getting on with the program. I am actually most grateful to welcome our 32 amazing students of the inaugural class of this regional campus. Less than a month ago, we welcomed you into this space, and I can say that you have brought Walden House to life in all possible ways, and it's just been amazing and so gratifying to see and meet all of you. You have very quickly established a community, have come together really as a unified voice. Our first leadership class, just been amazing to hear your stories, and I know you will all go on to be really wonderful leaders and transform medicine. So welcome to you. I'm also confident that you will go on to inhabit the spirit of Walden House, which some of you may have seen this, which is really inspired by Thoreau and the spirit of Walden Pond, and that you will go on and lead in that spirit. So I hope that everyone here has a chance to meet all of our wonderful young people who have joined our class. And after we have remarks, we will have some time for reception and to gather. So it is my pleasure to first introduce Kevin Taft, who is the president and CEO of Beth Israel Lahey Health, and has been very instrumental and supportive in making this a reality. Kevin.
Thank you. Well, good afternoon, everybody. It is really wonderful to see everybody here. You know, throughout a busy day, I participate in a lot of meetings. Most of them are not like this. I have to say, and the term has become a little bit of a political one, but this event really sparks joy, at least in my heart. And it's wonderful, really wonderful to be here with all of you to celebrate what I think ultimately will be a transformative educational initiative. And that's the way that I think about it, transformative. It's sprung to life right here in a partnership between Lahey and the UMass Chan Medical School. I can't think of a better partnership and a better place to create the kind of transformative educational experience that you all are now part of. As I was driving up here, I was reflecting a little bit to myself. I was thinking about today's celebration, and I was also, it brought back memories for me of my own experience as a medical student, which was a few years ago, I have to say, maybe longer ago than I would like to admit. But my own medical experience, medical school experience in the 80s, I was just, again, driving up thinking about it. It was, for me, it was remarkable and really life-changing. Life-changing personally, life-changing professionally, set me on my own career course, first as a physician, and then ultimately as a health system leader, although I never, ever thought that that's what I would have any interest in doing when I was a medical student. So I'd encourage all of you medical students to think about that. You never know what you'll end up doing. But the other thing that I would say that I was thinking about as I was looking back was not just how much of an effect it had on me, but I was also thinking about the fact that healthcare has changed tremendously over the last 4 decades. And it is high time that we train the next generation of caregivers, all of you, for the next generation of medicine. And I think for too long, we have really trained people the way that we used to do things and then expected to see something different. This is an amazing example of thinking differently, of really thinking forward, thinking boldly, thinking about the future, and training that next generation of caregivers for a future in healthcare that will be really, really different than what we see today. And I think that's tremendously exciting. It's exciting for me. It's exciting for our institution to be at the center of that change. And ultimately, I would say, as an academic health system, we consider it our responsibility to be at the center of this, to be at the center of advancing innovative educational programs, and that's exactly what this is. So again, I couldn't be more excited to be part of this, to see the faces in the room, the faces of the people, all of you who are going to shape the way that healthcare will look in 10, 20, 40 years from now. So to all of the students who now call UMass Lahey your academic home, welcome to our family, and thank you for your commitment, for your passion, and maybe as much as anything for leaning into making a difference in people's lives. That's the most important thing that you could do. Thank you again. And with that, I'm going to turn it back over to Dr. Mosenthal. Thank you.
Thank you, Kevin. Again, thank you for all your support. Now I have great pleasure in introducing Dr. Michael Collins, our Chancellor of UMass Chan, who will make a few remarks.
Thank you.
Well, good afternoon, everyone. Thank you very much, Dr. Tabb, for your thoughts and comments. Thank you, Dr. Mosenthal, for the kind introduction, and to you, Dr. Moffett-Bruce, thank you very much for saying yes when we were talking about this wonderful partnership. When Dr. Tabb and I had the final conversation before the agreement came together, we both admitted to each other that we were the only two people left who could screw it up. And and luckily we got it right, and it's worked out great. I thank you very much for your words. The truth is that though medicine has changed, much about it will remain the same. On each one of my desks at the medical school, at the house, at my office in Boston, I have a picture of the doctor, which is a picture of, it was painted by a painter by the name of Fides. The doctor actually has the face, Fides' face, the artist's face. There's a child laying on a bed, and mother grieving in the corner, head on her arm, and her husband's hand over. Many of you will remember that painting. And I have it there for a reason. Dr. Tabb is quite right. Things have really changed over the 40 years since we were in medical school. There are CAT scans and MRIs and genetic testing, lots of things. But what will always remain the same is the relationship between the doctor and the patient. The child in the painting has TB. There is nothing that can be done for the child except for the doctor to care for the patient. And the artist wants to, in the depiction of this child, make the case that the doctor really can be the most important person in the life of that patient in this most challenging time. And I think that all of you who are here to be part of the inaugural group of Lead at Lahey, you'll have that chance to sit aside the patient, to hold the patient's hand, and to recognize that that may be the most important therapeutic modality that you will ever be able to offer that patient long into the future. To Commissioner Goldstein and to Senator Friedman, I welcome you both. Thank you very much for being here today. We appreciate that this new campus benefits not only Burlington, but the surrounding communities. While our initial roots are in Worcester, let me be clear that we are the state's medical school, the Commonwealth's medical school. We are in 212 communities the last time we looked, with all of our offerings, and we are in just about every one of the 351 towns in the Commonwealth, given the large number of alumni from the medical school and the fact that there is a diaspora of practice throughout the Commonwealth, and we're very proud of that. We are proud that we go now from the Cape to the Berkshires, from Springfield to Burlington, and in every way, we are the Commonwealth's medical school. Kevin used the phrase that we're advancing the education for our learners. Well, in fact, we have, after the medical school had its new name, we had a conversation with internal and external constituencies, and it was very clear that collaboration was the foremost thought of folks who were reflecting on the medical school, and we've come up with a phrase, advancing together. And in every way, now we are advancing medical education together. We are going to advance UMass Chan-Lahey together. We are going to advance the career of these learners together. And that's really a pretty spectacular responsibility for those of us who have the great opportunity to steward these young folks' education. Governor Healy gave a terrific commencement address this year at the medical school. I invited each of the governors during their first year to come and give the commencement address at the medical school. And she turned a great phrase. She said that we weren't just any other medical school. She commented that we were based in the heart of the state. If you think of that for the moment, based in the heart of the state, and that we were a most important contributor to the education in the Commonwealth. I think she rightly pointed out that we do maintain fidelity to our founding mission. We have a huge research enterprise now, approaching $400 million in funding on an annual basis. But the founding mission was to educate the Commonwealth's workforce for the future. And she encouraged the new doctors and nurses and scientists to go out into the Commonwealth and beyond, fulfilling that responsibility. I think the fact now that we have this partnership with Beth Israel Lahey Health and are now establishing our second regional campus here in Burlington, our first being out at Bay State in Springfield, it reinforces that social responsibility that the medical school actually has adopted to, in fact, be the medical school for the entire Commonwealth. I want to thank Doctors Moffett, Bruce, and Mosenthal, along with my colleagues, Dean Flott and Vice Provost Larkin, for what you have done to create something that is so special. We have the largest medical school class in the history of the medical school at 235 students that have now been in school for 2-3 weeks, 32 of whom are here as lead at Lahey, the first lead at Lahey cohort and members of the Walden House community. And this is from an applicant base of more than 5,000 people. I will tell you that this would have been a very attractive offering to me when I applied to medical school had it existed. I think Dr. Tabb is quite right. We don't actually plan for careers in leadership. In many ways, they come to us. But the notion that I would have come to medical school to think not only about the education as a clinician, but to focus on leadership would have been something that was extremely attractive to me. And I think that I know the faculty here at Lahey, many of whom join us today, and all of whom I greatly appreciate, will now allow the majority of our class who stay and do their residencies in Massachusetts and who eventually practice in Massachusetts to now have a special part of their education, and that is to learn about, think about, and then teach us about how it's best to lead in their careers into the future. We don't pay a lot of attention to the U.S. News and World Report. I don't think anybody should really do that. But, you know, when you're named the single best medical school for primary care education in the Northeast, I do think that merits some attention. Others would say, not to worry about, but that's because they're not the single best medical school for education in the Northeast. And when you just think about that for the moment, think of the institutions that are within medical education in the Northeast. Let me say that again. Single best medical school in the Northeast. Frankly, you are going to lead with a purpose. And ultimately, I think human health and you will help to change the course of history of disease. And if that's not a weighty responsibility, I'm not exactly sure what is. So please know that the incredible faculty and the leadership teams based in Worcester and here in cooperation with Beth Israel Health, we stand ready to guide you, to challenge you, to support you. We look forward to being with you on Friday when you get your first white coats, a very important moment in the life of all medical students now in the country. We didn't have such a thing when we were in medical school. You literally went to Spar's Pharmacy over in the Longwood area. You bought a white coat, you got an ophthalmoscope and an otoscope. You hoped you didn't shine the light into your eye, it went the other way. You didn't know which way to put the stethoscope in, and you often looked like a waiter in a restaurant because you buttoned all the buttons up on the white coat and had no clue what you were doing. But now on Friday, we have this amazing ceremony where families will come from across the country to be with our learners as they get their first white coat. And it'll be extremely special for us to have the first cohort of the Lead at Lahey students and the Walden House to be part of that. So thanks all of you for being here today. It's the privilege of a lifetime to have the opportunity to lead the medical school at this incredible time in its history. It's even more incredible to have the opportunity to lead your medical school as we steward your education. And we want you to feel most welcome at UMass Chan. We want to thank our faculty throughout the medical school for what they do to make our learners the best in the nation. Thank you all.
Thank you, Chancellor Collins. Very, very heartfelt, and it truly does resonate, because in my day, we did not have white coat ceremonies either. So I would like to introduce Dr. Robert Goldstein, Commissioner of Public Health for the state of Massachusetts, who is going to give us a perspective about the importance of our physician workforce. Thank you.
Good afternoon, everyone. I did have a white coat ceremony when I went to medical school. It is actually a really remarkable moment to walk across that stage. I'll start by just saying it's really wonderful to be here for this celebration and the celebration of innovation in medical education. And I feel like I'm talking to this group of students way in the back there. There's space up here if you want to move up. I really jumped at this opportunity to come speak today. Partly that's because Jen Burrell from BILH asked me, and I learned early on never say no to Jen Burrell. But it's really because I had the opportunity to speak to all of the students who are here today. It's really a wonderful day. It's wonderful outside. It's wonderful in here. And we get to recognize the UMass Chan-Lahey Hospital Medical Center taking a really important first step, a step together in medical education. This is becoming a model of modern medical education that aims high in stretching the imagination and expanding everyone's curiosity for the things that you're going to learn and how you're going to grow, how you're going to think, and how you're going to thrive here. Clearly, as you've heard from everyone, medical education has been undergoing and continues to undergo enormous change. It really has to. Right? Biomedical science has evolved, knowledge has exploded, technology has changed how we learn, how we practice medicine, how we advance care. And learning the art and the science of medicine today happens not just in the classroom or in the clinic or in the lab, but it happens in our communities, and it happens within our cultures. Effective medical education weaves the principles of equity and justice into every aspect of learning, and explores and it addresses the social determinants of health, the implicit biases, and the systemic inequities that exist. Here at Lahey, through Lead at Lahey, the students and the trainees are going to be equipped with the cutting-edge medical knowledge that's so necessary, but also with the cultural competence and the ethical grounding that's necessary to serve the diverse populations that exist. The next generation of leaders, everyone in the back of this room, you have to be advocates. Advocates for something that is more just. Advocates for an inclusive healthcare system. When I think back about my journey in medicine, I was set on a career early on that was dedicated to caring for patients with HIV and being a primary care physician. I trained in medicine and I went on to specialize in infectious diseases, and through my work with HIV and with the people affected by the disease, I realized that while we were making significant strides in HIV care, there were communities, and in particular the transgender community, that were facing significant gaps in healthcare. And that realization shifted my focus. And I found myself caring for and advocating for transgender patients and starting a highly focused practice at Mass General for which the need was urgent and the challenges were enormous. And I thought at the time that my clinical practice was where I would spend my years, but my journey didn't stop. At the time, the chief of infectious diseases at Mass General was Dr. Rochelle Walensky, who became the director for the Centers for Disease Control and Prevention in 2021. And Dr. Walensky asked me to work with her at CDC as her senior policy advisor. I spent 2 years there at CDC in the midst of the COVID pandemic, I would say at the height of the COVID pandemic. I gained an appreciation for the vast and the complex world of public health and public policy, and the ability to make a difference, not just for individual patients, but for whole populations and for whole communities. And now, in my role as commissioner, I get to see every day how our work in medicine and public health has an imprint that can shape future generations. So this partnership and this regional campus represents the future that I think we all hope for. A future where equity, inclusion, and innovation are not just promises that we make to each other, they're priorities, they're guiding principles. This campus will be an engaging place where students and faculty and researchers can explore new ideas, they can challenge the status quo, and they can discover how they can contribute to that just and inclusive world. So to the students way in the back there, who are part of this inaugural class, I encourage you to walk through the many doors that will be open to you. The path that you set on today might not be the one that you ultimately follow. That's okay. And in fact, that can be great. You should keep your curiosity alive, and you should remain open to the unexpected. It might be in the place that you least expect that you'll find the greatest opportunities to make your mark. So I want to congratulate you, the students, for being part of this inaugural class, and BI, Beth Israel Lahey, and UMass Chan for this partnership. I look forward to seeing all the great work and the great ideas and all of the great leaders in medicine and health that will come through this campus in the years ahead. Thank you for having me today.
Thank you, Dr. Goldstein. And now I would like to introduce our Senator Friedman, who represents Middlesex and has been very supportive and involved in the creation of this campus, and I think is as proud as we are in making this a reality. Thank you.
Thank you. Hi, everyone. I'm Cindy Friedman. I'm the state senator from that represents the great city or town of Burlington. I'm also the chair of the Healthcare Finance Committee, and I'm also the vice chair of the Senate Ways and Means. And that's why they all are glad that I'm here. But I am really, really happy to be here. You know, we all know what's been happening in healthcare in Massachusetts in the past 6 or 7 or 8 months, a train long time coming toward its wreckage, but it is just the poster child for what's happening across the country in healthcare. And from my vantage point, I not only see the healthcare piece, the actual delivery, but I also see all of the other forces that are involved in the healthcare system. And so the first thing I want to say is thank you, thank you, thank you, thank you, thank you for deciding that you are going to be a doctor, because we desperately need you. And thank you, thank you, thank you for being part of this kind of program. Because the truth is you have no small task before you. And yes, while the fundamentals of healthcare is about taking care of people, we have gotten so far away from that in the greater system. And now we're asking you, we're begging you, we're pleading you to become the leaders that are going to bring us back to the fundamentals, which is about taking care of a human being. And so this program is so important because, as Commissioner Goldstein said, it's about all of the things that we need to do to be true to our words and our values about that we really are here to take care of somebody. And that means equity across the board. It means cultural competence. It means dealing with a system that often isn't about healthcare, but it's about the bottom line. And those are such huge, huge tasks that we are going to ask you to figure out. And no pressure, but we have about 3 to 5 months. So I would just say get to work. It's not quite that bad, but we really are at a real crisis point in healthcare. And we need you and your energy and your life experience, which is so important, because for so long, the life experience of people coming into healthcare has been pretty uniform. And that's not what our Commonwealth is anymore. It's not what our country is anymore. So we need all of the things that you bring. And I am really grateful to the Chan School, to B.I. Lahey, to all the people that put this together that are willing to do it. But I am especially grateful to you all. And I promise that we will work really, really hard to solve the housing crisis, so you all will stay in Massachusetts. So I wish you all enormous luck in going forward. I know it's hard work. Please have some fun, and please remember that there is no better thing for you to be doing than taking care of us. So, thank you.
Well, I hope all of you are feeling inspired and perhaps a little afraid that you have a lot of expectations on your shoulders. So with that, I would like to invite our Dean and Provost of UMass Chan Medical School, Dr. Terry Flott, who has really been such a welcoming partner in all of this. So thank you.
Thank you, Anne. So just let me add my thanks to Dr. Tabb and Dean Mosenthal, to the rest of our team, Dr. Larkin and her team, as well as for the support from Commissioner Goldstein and also Senator Friedman. You know, leadership has been the theme today. I'm going to go a little bit off script because I think, you know, one definition of leadership would be to have the vision to see a future that's a lot different than it is now, and the courage to follow that vision. And I'm thinking in particular of 2007 when Chancellor Collins started on our campus, and I had the pleasure to also be able to partner with him beginning in that year. And he had the vision that we could make the state's only public medical school bigger than it was, a larger class size, more opportunities. It was so unthinkable to the folks who had been there, because it had been 100 basically since the founding. It was folklore, as we now know, urban legend, we did not know at the time, that it was an actual state law, that we could only have 100 medical schools. We were told that by many people, and the chancellor had someone go and do the search, and it turned out that was not true. It was a handshake agreement, not a statute, not a constitutional amendment or provision. But he saw that he saw that vision, and so we've grown over that time from 100 to 235, which is really jaw-dropping. It is not something anyone would have imagined at that time. Now, it's not just to think that bigger is better, but every seat that we open up in medical school represents an opportunity. It represents an opportunity to train more of the healthcare workforce for Massachusetts, but for the student, as Dr. Tapp mentioned, for an individual student to enter medical school is a life-changing experience for them. I think that our students would agree with that. And so we wouldn't have been able to offer this expanded opportunity the way that we were, which was really focused around one major hospital system in central Massachusetts. And so over time, based on that vision, we have sought out and identified amazing teaching health system partners. Most recent of which, the most natural of which, I would say, has been BI Lahey Health around this UMass Chan-Lahey campus. It has been a tremendously spontaneous, wonderful, joyful experience, as others have mentioned. Now, there's another dimension, though, of this class going from 100 to 235 that I wanted to mention that is also part of the story this afternoon. And that is that one worry with a bigger class size was that the students might get lost in a large class size. So beginning in 2010, around the time when the expansion really started in earnest, our faculty had the foresight to develop a curriculum based on learning communities. So the Lead at Lahey track is the curriculum track the students here have chosen, but the Walden Learning Community really is a community of just about a little over 24 students in each class, a little more than that this year, it turns out, but on average about 25 students in each learning community, and really with much of the sense of true community with each other, with their faculty, with their mentors who guide them through the various stages of medical school and the stresses of medical school, to be able to approach those things with a purpose and with a sense of really the safety and security that comes from people who really know you very well. So again, I think the way this learning community and this Lahey track has come together has been just an absolutely phenomenal partnership. Really, the ideas around leadership really emerged from the UMass Chan-Lahey faculty. And we're really all looking forward to what this class has to offer. Now, I will say one last thing about the first class of Lead at Lahey students. So whenever you start something new, this is the very first class of Lead at Lahey, you don't know quite how many people are going to want to do it. And so we, Dr. Keating, who's giggling back, or actually I think it's Dr. Keats giggling about her, who is our admissions dean, they offered up enough acceptance letters to the Lead at Lahey campus that for the Lead at Lahey track that we expected to get about 25 students. For the first year, we would have been happy with something like 18 to 20 would have been okay. So number of offers were given, and needless to say, the uptake of those offers far exceeded expectations. So, so this turned out it was a pretty good idea so far, and I do want to thank all the students who have had the courage to be that pioneering first class. You know, we all, you know, medical education is a learning experience for both the faculty and for the students. So we do look forward very much to learning a lot from you. So I know we have refreshments, we have tours, we have other people to speak, so I'll just end by, again, thanking Dean Mosenthal. I know we've already heard a quote from one of our candidates. I'm going to quote one of my favorite old movies and say, perhaps this will be the start of a beautiful friendship. Yeah.
I think so, and then some more. Thank you, Dean Platt, for those comments. And I would like to introduce, last but definitely not least, our president of Lahey, Dr. Susan Moffett-Bruce, who will give our closing remarks, and then we will have time for celebration.
Thank you, Anne. Well, thank you, everybody, for being here. Thank you to our officials for being here, and thank you to our medical students and all of our guests. This has been quite a journey, and in particular, I really want to thank our team under Dean Mosenthal's leadership, who's not only put today together, but everything together over the last 18 months. It has been a tremendous journey, so thank you, Anne. And these medical students, this team, the faculty that's engaged has brought such an energy to Lahey. It has been palpable, it's been appreciated at a time when healthcare is tough. And so we are very grateful to be uplifted by this class, by this work, because it's really going to be our sustainable future that we see and we want to invest in. So thank you. Dr. Lahey's vision 101 years ago was to serve the community. And I think that were he here today, I think he would be surprised, but I think he'd be pleased. And so I have challenged the medical students that they, with their great vision, passion, and energy, that they will take us forward for the next century. And we will trust in that. I often open in gratitude, but today I'm going to close in gratitude and a thank you for your trust. Thank you to Kevin and Peter and Rob, the BILH leadership, for trusting in us to become a medical school. Thank you, Jane, trustees, and grateful patients for trusting in us to do this and be on this terrific adventure. Thank you to the Chancellor and to the Dean and other deans for helping us to become successful thus far. And in particular, I want to thank the students for trusting in us and truly allowing us to take them forward on their learning journey. Thank you to all for attending today. We're grateful. We hope you enjoy our Walden House and all the cupcakes that you can eat. Thank you. Be well.
Thank you to everyone for your remarks. This has just been such a gift for me to have all of you here and to see this come to fruition, and these amazing students who will be my physicians, hopefully, not too far from now. Please enjoy. I know many are excited to meet our students as well as our faculty. So thank you to everyone for joining, and a special thank you to my team for making this happen.